Good morning, everyone. Good morning, Queensland, and good morning to all of our Facebook Live viewers. And what a beautiful day it is out there today. Absolutely gorgeous. But can I start off by giving our COVID update? Then we've got some modelling we want to talk about, some updated modelling, which I think Queenslanders will be very interested to hear about. And of course, there's a meeting of National Cabinet later on today as well. So I'll start by there's been 5,854 new cases, including 2,647 positive rats. It's my sad duty to once again report that there have been 8 people who have lost their lives overnight. The Chief Health Officer will give some more details about that. And we extend, of course, our condolences to the families of people who've lost their loved ones, and 2 of the 8 people were residents in aged care. And as I said yesterday, we're looking forward to hearing more details about what Defence Force troops are going into different aged care facilities. I'm quite sure that that'll be an issue raised at National Cabinet later on today. In relation to tests, 15,295 tests. And in relation to our public hospitals, the number of people in hospitals are 579. So you might recall yesterday that was 628, and at the peak it was 928. So that's coming down, which is really good news. But of course, we don't expect to see the end of that peak till the end of this month, and there'll be a bit of a tail during March. There's 46 people in ICU. And our vaccine coverage is 92.25% at least one dose and 90.08% double dose. In relation to boosters, good news there, 59.96% of eligible Queenslanders have had their booster. Please, please, please go and get that booster. When I was at Bundaberg Airport yesterday, I was speaking to some people there, and they were very proud to tell me that they had their booster and all of their friends have had their boosters. So please go and get that booster. It's really, really important. And then we've also now had 3.375 million rats distributed to HHSs and Queensland Ambulance Services since the 6th of January. So it's good to see that supply is coming in well, which is helping everyone as well. Okay, so in relation to the modelling that the Chief Health Officer and the Health Minister are releasing today, it's in relation to our current wave. So, of course, we'll do more comprehensive modelling as well at the end of the wave, at the end of February into March. But I just think this modelling is quite interesting, and I'll probably talk a little bit about it at National Cabinet today as well. So, of course, our initial modelling, if you remember, we looked at anywhere from 3,000 to 5,000 people we were expecting going into hospital, and around 300 to 500 people going into ICU. Instead, we've had a peak of 925 and in hospital and 71 in ICU. And as you heard today, that is down to 579 in our hospitals and 46 in ICU. So based on that modelling, we can be cautiously optimistic that as a state, our hospitalisations have peaked and are trending down. And I do want to thank Queenslanders for going out and getting vaccinated and getting boosted. We were at that very fortunate situation that we were able to get 80% of our population vaccinated before the virus came in. If you remember, before December, we actually stated very clearly that we needed people to get vaccinated because we were reuniting families for Christmas and New Year and the holidays, and we needed to get our vaccination rates up as high as we possibly could. And we did that. Queenslanders came out in droves and did that. So it means that our precautions and planning have been working, and whilst our hospitals are challenged, and I do appreciate the hard work that our hospital staff are doing, plus our ambulance staff right across the board, they have done a mighty job, and they keep doing a mighty job as well. So on behalf of Queenslanders, thank you to all of our hard-working staff out there, anyone on that front line that's been dealing with this pandemic. I'd love to say it's over, but it's not. We've still got coming down off that peak, and of course we're going to also see a tail end in March, and then of course we'll be preparing for the flu season. If there is a flu season in the winter months, but we'll get to more information about that as information comes to hand. So the areas past their peak are the Gold Coast, Metro North, West Moreton, Mackay. Areas just past their peak are Metro South, Sunshine Coast, Cairns and Hinterland. And the areas approaching their peak are Townsville, Wide Bay, Northwest and Torres Cape. The Darling Downs and Central Queensland are yet to peak. 8.7% of the Gold Coast population had the virus, and in Cairns 8.1% of the population had the virus. So I'll get the Chief Health Officer to give you some more information, but Queenslanders should be very proud of the work that they've done going out and getting vaccinated. It's actually kept the community safe, and it was lovely to be in Bundaberg seeing people out and about as they are across the state, people backing in our tourism industry as well, which is great to see, and I just want to thank Queenslanders. Thanks.
Thank you very much, Premier. So sadly we have eight deaths to report today, 2 people in their 60s, 4 in their 80s and 2 in their 90s. 3 of these 8 were not vaccinated, 1 had received a single dose of vaccine, 3 had received 2 doses of vaccine, and only 1 had received a booster. And again, our thoughts are with their families. As the Premier has said, our inpatient numbers continue to fall rapidly. We're down to 579 people in our public hospitals being treated for COVID-19, down from 628 yesterday, and down from well over 900 on the 25th of January when we were at our peak. That's the aggregate peak for the state of Queensland. That includes 46 people in intensive care, 22 of whom are ventilated. In the private hospitals, we have 54 patients in intensive care, being treated for COVID in our private hospitals. It was 58 yesterday, you might recall. Looking at children, again, the children have only gone back to school this week. Just the PCR results on children, for children aged 5 to 11, there were 231 positive PCR reports yesterday, which was actually down from the previous day when it was 295. And there were 239 in the 12 to there were 180 in the 12 to 17-year-old age group, which was down from 239 yesterday. So I'll say that again to clarify. In the 5 to 11-year-old age group, 231 in the last reporting period, down from 295 yesterday, and in the 12 to 17-year-old age group, 180 PCR positives, down from 239 the preceding 24-hour period. We are just tidying up the rapid antigen test results, which we'll be reporting to you. We notice that some people are entering the birth date in the test date field and vice versa, so we just have to sort that out before we report them. But we're hoping to report the self-reported rapid antigen test results to you as well. It is very early to see any impact of schooling on the transmission of the virus among children. But as I mentioned yesterday, there was clearly quite a significant transmission among children in the 3 weeks leading up to the opening of schools. In fact, the numbers have been in decline over the last 3 weeks when we analysed these data over the last few days. So there will be some immunity among children going back to school, but we still expect more cases to be seen in schools, as we predicted from the beginning. I'll now hand over to the Minister. Thank you.
Thank you, and can I also just acknowledge the families and loved ones of the 8 individuals who we're reporting today who have passed away, who tested positive for COVID, and I am pleased with what we are starting to see with not just our data and modelling, but we are seeing for ourselves a reduction in hospital beds, in the pressure on our ambulances and our hospital system. There are still, of course, some of our hospitals and some hospital and health services that are, still managing reasonably high rates for normal time of year, obviously because of the COVID patients, but you know, we are seeing most or many hospitals sort of down to 1 or 2 wards now. I'm remembering at our peak we had 9 wards dedicated at Gold Coast Hospital alone just to COVID. So it's good to see a bit of relief coming for our health workers. Can I give a shout out to all those businesses as I go around? Staff are telling me how there's private businesses out there who are providing meals for our health workers and other support and free coffee and all those sorts of things. So it's wonderful to see the support for our frontline workers out in the community. But it's wonderful what the data has shown us. We were, at the start of Omicron, modelling on worst case scenario of up to 5,000 hospital beds at our peak and up to 500 ICU beds. And to know that we have peaked at 928 hospital beds and 71 ICU and be down to 579 today and 46 ICU beds is a real reflection of the great work that everyone in Queensland has done to go out and get vaccinated, to wear their masks, to socially distance, the good hygiene, to follow all of the requests that we have put to the community over the last 2 years, and particularly since we opened up in December and started having this wave of Omicron. And it's, I'm pleased to say that our number of staff that are having to isolate and quarantine across health and ambulance services have declined again overnight. We're now at 1,830 staff. That's down from 2,148 yesterday. So that's great. That's over 300 additional staff back in the workplace. And I think that's showing a reflection of what is happening in the broader community as well. And we hope that that takes a bit of pressure off those employers out there, our retailers, supermarkets, distribution centres and so forth, who are really facing difficult times with such a shortage of staff, that we're seeing improvement in that area as well. What this data shows is not that there isn't a need to get vaccinated anymore, it shows the success of vaccination. So please, go out and get your booster. Go get your first and second jab. To those parents who haven't got their 5 to 15-year-olds vaccinated yet, please come forward and get them vaccinated. We want to see those numbers. It's good to see we've hit 40.11% of the 5 to 11-year-olds, but I still want to see those figures higher. So please coming out and getting vaccinated, and of course continuing to get tested. And I would ask parents, if you are doing rapid antigen tests at home on your children and you're getting a positive result, please make sure that you're not just registering with the Commonwealth website, you are registering with the Queensland website so that we are aware of those positive cases as well. Thank you.
Dr. Gerard, you mentioned Tony mentioned that 80% roughly on the Gold Coast who have got the virus. How high in reality do you think that figure is, given when you get the virus and don't know what's going on?
What percentage of the Gold Coast do we believe?
Yeah, like Tony mentioned that 8%. How high in reality though is it?
Well, you would be aware that a study is being performed, it continues to be performed on the Gold Coast, looking at how many people are truly infected by going from house to house on the Gold Coast and testing selected households at random. And we know that only 10 to 20% of people who tested positive are were aware in this study that they were in fact positive. So the number could be as much as 5 to 10 times what we're actually reporting. So I think our original modelling suggested that up to 50% of the Queensland population could be infected with this virus by the end of February, and I think that's very credible. I think it's credible that half of the population of Queensland could be infected with this virus by the end of this month, could have been infected by this virus, and most having mild symptoms. I mean, there will be further studies that will be done at a national level to try and ask this question, because it's obviously a very important question. How many of us have really been infected? Because what we're seeing is the establishment of a wall of immunity. And we're seeing immunity through vaccination, through boostering, and through natural infection. And those three arms are creating a wall of immunity in the Queensland community. because what we don't know, and it really is an unknown, is what happens as we go forward, particularly coming into the winter. We just don't know. The world has experienced the Omicron wave simultaneously. In the Northern Hemisphere, it's been in the winter, and here in the Southern Hemisphere, it's been in the summer. We'll be the first, being in the Southern Hemisphere, to go into the winter following this international Omicron wave. And we don't know whether the amount of immunity that we've established through natural infection and vaccination is enough to protect us from another wave. And if there is a wave, how big this wave will be. I would certainly, and I cannot overemphasise this, encourage people to get boosters, particularly older people and those who are vulnerable. But we know there has been substantial natural transmission of infection, particularly in that younger age group, who seem to be that group that spreads the virus in the community, that group from late teens to 20s and early 30s. There was a lot of transmission in that group early on, about 3 or 4 weeks ago, and that will have established some degree of immunity. The other unknown, of course, well, a couple of other unknowns, is how long does immunity last, and are there going to be new variants? But there is clearly a lot of immunity to this virus now out there in the Queensland community going forward.
Those people who still haven't had their first jab, for example, and they're thinking, oh well, this, the peak's over, maybe the mandate might, be relaxed.
It's very clear the virus is not going to go away. It will continue to circulate, and if you have not been vaccinated, it will find you eventually. If it hasn't found you yet, it will. And the unvaccinated will always be sicker than the vaccinated.
Premier, just yesterday you announced some pretty major announcement for tourism moving forward.
Yes.
And the media reports suggested, and in your own words, suggested that you're just going on 2 jabs unless the target changes its mind.
Yeah, we're very happy with the vaccination of the double dose. But it's up to the federal government if ATAGI gives the federal government any other advice. But
it's not your call. It's
correct. It's a national decision. That's right. But at the moment, I know there's a differing view from Victoria, but at the moment, Queensland is very happy with the double dose vaccination of people coming in here. And of course, if you're unvaccinated, you have to quarantine.
So that would probably be, well, there's no choice because it would be a national guideline, and the other states would be adopting a very similar
correct.
guideline.
Yes. Yeah, you're absolutely correct. Yeah.
And just on the 90%,
Yes. Isn't that fantastic news? I was so excited to hear that the other day.
Yeah, but you did it after the press conference.
We've got the mandate and mask still. The position says there's been no reward for businesses because if you hit that target and nothing's really changed, has it?
Well, we'd like to see more, of course. So, we want to protect people who are going into businesses, especially like cafes and restaurants, so they know everyone else in there is fully vaccinated. So our percentage for children's coming up now, that 40%. Our boosters is coming up, 59%, almost 60%. So we still do need to wear the masks, especially in indoor settings, in work environments. But, we will review that, of course, at the end of when we come down off that wave at the end of February.
What do you say to those tourism operators that are worried about, say, the booster shot being mandated for those international tourists?
Well, what I say, that's up to the federal government. I mean, the federal government gets the advice to ATAGI, it would go to National Cabinet. I have not heard any evidence to date that that is required. So until I get evidence of that, it would be a national decision if ATAGI has provided that advice.
What do you say to
Yeah.
the aged care sector? It gets quite confusing.
Yeah.
A lot of people think that it's your call, but it's not. Do you think they'll get to a moment, because this is happening in your backyard, where the Premier, you'll just step in and go, look, I have to do something here because it's happening here.
Look, that's a really good point, and I hope we have a really good discussion at National Cabinet about aged care because, look, it is a big issue. I lost my grandmother when this pandemic was just starting, and she said, when is this going to end? So I understand how people, their loved ones are basically in care and they expect the highest amount of care for protection. So it would be very distressing to a lot of people at the moment. At the end of the day, these are Queenslanders and they are Australians, okay? So we want the best. So if we need to step in and do anything further to help out, we will. Already in some aged care facilities where they've asked for PPE, I know the Health Minister has actioned that. If the Commonwealth needs extra help of people going in and helping with the vaccination program, but we were advised at National Cabinet that the vast majority of aged care residents had their boosters. So I think today we just need to get the facts on the table, and I'm quite sure that the Prime Minister will do that, but we need to have the facts on the table as to how many people have actually had their boosters and how many of the staff have had their boosters.
Does it frustrate you to see the reports about Jeddah Gardens, because you're kind of sitting there going, I want to do something, but again, you'd be stepping on the federal government's toe.
And that's why, look, I think everyone just needs to help out together here. I mean, these are the most vulnerable people that we have in our nation and in our state. So if we can, look, I'm happy to do whatever we can to assist. But also too, I think it needs to work the other way as well, and I think that the federal government needs to tell us where the Defence Forces are going, and let's work on this together. I mean,
Premier, the federal government was under a lot of pressure about the standard of aged care services before the COVID.
Correct. You've made a very good point.
A disproportionate number of elderly people dying.
It's tragic. It's tragic.
The federal government doesn't seem to be able to, even though these deaths are normally not subjected to the usual levels of coronial scrutiny, there seems to be among the relatives of the families of the victims some confusion about whether they died with COVID or because of COVID.
Yeah.
There's a drug that's used as a sedative apparently that replicates the respiratory symptoms of COVID.
Look, you've heard.
Sort of detail on the federal government to look into.
Well, I think you should listen to the Chief Health Officer, and he will talk that sometimes there's a culmination of factors. Some people entering into aged care have complex health conditions. But I think what the issue is at the moment is that not only do we have the people who are living in aged care that have COVID, but it's the staff as well. And it's that the staff not being able to provide the care that I think is the central issue here. And I think it goes to the crux of the matter too about how much do we pay our aged care staff. I mean, they're looking after our most vulnerable, but they're looking after people who've worked hard for our nation for many, many years.
When you're talking about the state assisting in terms of aged care, in the past that the state stepped up to help vaccinate aged care workers, is that something that Queensland would consider again with the booster?
Look, I'm happy to help out where we can. Let's have that conversation at National Cabinet, but I know that the Commonwealth is speaking to the Health Department, so let's work on this together.
Well, you've got another issue.
Yeah.
Leading forensic scientist Kirsty Wright has found that the state-run lab has failed to find DNA samples in rape and sexual assault cases when they should be able to find them every time. Is the lab failing victims, and will the government hold an independent inquiry into that lab?
I think from my understanding about in one particular case that the coroner has reopened its inquiry, so we should have a look and see what the coronial inquiry says. Yeah.
This is a report that was released in 2020 that tested hundreds of samples and found it was only picking it up about 52% of the time.
Well, the Health Minister might be able to address that. Yeah.
Can I ask the Health Minister?
Yeah, sure. Are there any other questions for me?
Oh, yes, sure.
Yeah.
Social housing premier.
Yes.
The wait list has increased. Has the government?
Look, in relation to housing, and let me say that I'm very proud of our government's investment in housing, over $2.9 billion for social and affordable housing, and it's the largest investment that we've ever seen in social housing in Queensland's history. We've commenced 4,036 new social homes since 2015-16, 2,972 since the release of the Queensland Housing Strategy in 2017. I know how important housing is. It provides a roof over people's heads. It's important for families, and that is why our housing minister, I see her out there all the time opening new social housing properties across this state. I also applaud the private sector that is now doing affordable housing for people entering that market. And I was just up at Caloundra South the other day where we were opening up a brand new school, and it was interesting to see that they were actually building, townhouses for either young people who are looking into getting into the market, who are buying their first home, or people who are maybe considering retiring, or elderly people who want to live close to good amenities where there is in the particular housing development. So I think that in terms of housing, it is incredibly important. There will always be need, but we are building the housing as quickly and safely as possible.
So these figures say there's 50,000 Queenslanders that are on a wait list. Is that enough?
Well, $2.9 billion investment, and the plans have to take place, acquiring the land, building the social housing, but also to reflecting the needs as well. So I remember over time, sometimes it's gone from being small families to larger families, also to repurposing the homes. Some of the homes might outdate. I know this has happened in my own electorate of Inala, and what they do then is they might actually demolish 2 or 3 houses and build a suite of affordable social housing for pensioners, and they might be 1 or 2 bedrooms so they can have family relatives come and stay with them. So this planning is happening right across the state. It's not just in the southeast. And Labor governments have always done renewal of social housing, always invested in social housing, because we fundamentally believe that we need to look after those people who, through no fault of their own, find themselves in a situation where they need to have adequate housing, and families need that. So we will always, and that's why we have the largest investment.
Do you feel those people still waiting though?
Sorry?
Do you feel those people still waiting?
Yeah, but we've got the largest investment, and I think we need to also make sure that we are that developers are also building appropriate housing for those people who can enter the market, those first homeowners, and that's why we've put in first home owners grants, which are matched with the federal government to help people enter that market as well.
What has been the actual net increase though in social housing that has been delivered under your government?
I'll get that for you from the Housing Minister.
And just in terms of that report that you discussed earlier in the week in relation to Mrs. Summerall's
Yes.
archives, any indication yet on when that's going to be released?
It's, as I said yesterday, it's with the CCC, is my understanding, and as soon as it comes back, it's going to be released.
It's not going to be released at 5 p.m. on Friday afternoon.
I hope not.
And why was it?
Well, it depends what time the CCC brings it.
Was it actually sent to the CCC though? Because I think on Monday you were suggesting you weren't quite sure. Do you know if it was sent to the CCC?
All I know is that the CCC has been written to.
And why do they need to provide clearance on it?
Well, you'll have to ask them.
But you're asking for the clearance.
The department's doing it, okay? So you'll, yeah. Yep. Any others?
I just have one more, Premier, while you're there.
Yep.
It's actually on social media.
Yeah, sure.
You've expanded your presence into social media in the past couple of years, Facebook, Twitter, TikTok, Instagram. Do you like that trend, and do you want to see that continue?
Well, I think what we know is that there's a changing media landscape, and it's not just this government, it's I think nearly every government in Australia, and even the national government, where people get their news and information by different sources. Young people use Instagram, and I've seen many of you on Twitter and Instagram, and then of course we have Facebook for older people like myself and the older generations. And I can remember when I started off like 30 years ago in my first job, we were doing faxes. No one has faxes anymore. So it's just an evolving situation. And I think I've just recently heard about TikTok as well. So, everything's changing. Who knows what we're going to have in the next year, let alone the next 5 or 10 years.
Did you follow me, Premier, on Twitter?
I try to follow all of you. See what you're up to.
Can I just clarify, sorry, with National Cabinet?
Yes.
Will you be raising specifically the Jeddah aged care home, or will you just be talking about aged care in general?
I think I'll definitely be raising that as an example, of course. It's very distressing to the families there. But I have been raising aged care at the last 2 National Cabinet meetings.
Are you aware it's on the Jeddah nursing home of a drug called midazolam?
No, I'm not. No.
It's a very strong sedative.
Yeah, I'm not aware of
That's
that.
the one I mentioned that
Yeah.
replicates the symptoms of coma.
Yeah, sure. Thanks, everyone.
Minister, just further to my question to the Premier, this isn't about a single case. This case shows hundreds of victims whose cases might have fallen over because bungles in DNA evidence taking. So will the government hold an independent
But I understand that gathering of that information was part of a consideration in relation to that individual case. Look, there has been no evidence of systemic failings in our forensic pathology unit, and can I say, this is the same pathology units who have done an outstanding job looking after this state since the start of COVID in 2020. They are the ones who also discovered the new variant of Omicron, which is now BA2, that is now globally being discussed. They have done an extraordinary job and continue to do it each and every day. I appreciate that there's one report out there, but that does not show a systemic failing in the system. And I do welcome, it was actually myself who wrote to the Attorney-General in relation to the allegations around the pathology in that case, but it doesn't just go to that one case. What it says is there was allegations made around the failings of pathology more generally that are linked to that case. Now, I requested that that go back to the coroner. I am pleased that the coroner is reopening that. This will give the coroner a chance to look at the pathology and whether the coroner believes there are any failings. And I have no doubt that the individuals who have put forward this information into the public arena will put that same information forward to the coroner. And I also know the coroners will not hesitate if they believe that there are systemic issues in relation to any collection and testing that occurs in our forensic pathology units. And I'll certainly look at any recommendations that come out of that coroner's report.
That case was from 2013. This paper was released in 2020 and it showed thousands of DNA samples taken from crime scenes showed no DNA profile. Then when they're retested, suddenly there's a DNA profile. How is that not a problem?
Look, that report has not, I don't know the person you're talking about with that report. Happy to get a briefing on that particular report, but there has been nothing put forward by any stakeholders in the criminal space, in the courts, with the coroners, that says there is a systemic problem with our forensic pathology units.
The person that looked into this is the same person who's been raising Kirsty Wright.
And I appreciate there is one person who has put a report together, but I'm telling you that the criminal justice system, whether it's the police, whether it's criminal lawyers, whether it's the courts, whether it's the coroners, there has not been one body, beside this one report, there has not been one body that has come forward that operate in this space every single day and said we have systemic failings.
What about the Auditor General's report in 2018 and 19 that showed failures in the forensic lights running?
Well, as I say, you know, whenever there are independent reports or audits or whatever else, we look at those recommendations. We are constantly improving our systems. But I don't accept that there is a finding of systemic failing in our pathology units.
Anybody in government reached out to Dr. Wright?
I haven't. I haven't. What I did is write to the Attorney-General, because those allegations do go all the way back. Those allegations, you're right, are from the same individual. And those allegations go all the way back to this case. So there is an opportunity there for the coroner to have a look at the forensic pathology and whether there is any failings.
You've got to get going. The Shadow Minister, Health Minister this morning has said that ambulance, that 22,000 hours in just 2 months due to ramping. Is your response to that?
Based on which data are they relying on? I suspect it's one that was released, you know, for the last quarter or the quarter before then. Look, you can look at figures on paper. I've been travelling across the state. I've been standing at emergency department bays, talking with paramedics as they arrive. I was at Cairns Ambulance Station and talking to their operational centre yesterday, and they're all telling me that the measures that we've been putting in place are starting to see a real improvement. As I say, down on at the Gold Coast, the paramedics and the supervisor paramedic that we have now based there as the ambulances come in and the new triaging system said they've seen a 60% reduction in their lost time. Cairns ambulance station yesterday and the operations centre, I walked into the ambulance bay. There are ambulances sitting there waiting for jobs. The operational staff said for the first time in months, in the last 2 weeks, they're starting to see some reprieve, and they are so grateful to see that peak starting to come down. There is more work to be done when it comes to ramping, emergency department, and finding relief as far as hospital beds in our hospital system. But certainly what I'm hearing, and yesterday again I was told our co-responder mental health model that we now have operational with paramedics has seen a 80 to 90% diversion away from taking a patient to an ED who's having a mental health episode. That's come directly from the Assistant Commissioner and paramedics working on the ground in Cairns.
Put to the Premier, would you consider your own investigation into Jeddah if it gets worse and you'd like to, I guess, step in?
Yeah, look, we've been getting regular reports on Jeddah Gardens. I am hearing that it's starting to stabilise. More staff are starting to come back into the workplace now from quarantining and isolating. I do think we need to watch it very closely. Yeah, I've asked this morning, can we find out when our first discussions were happening with the Commonwealth? Because the regulator body deemed this a high-risk site the day we notified the Commonwealth at a senior level. Now, they should have absolutely known about this. A private provider was already in there assisting. There was lots happening on the ground, and our team, through all of their local discussions with the Commonwealth and private providers, felt the need to escalate it to a minister's office. But why is it at that point that the regulator then deemed it high risk, when I understand that the facility had been given a breach back in August? So I do want to know about that. We do have to work together, and as the Premier said, you know, we will do anything we can to help. And in fact, this week I've been advised that at least a third of our hospital and health services are voluntarily doing in-reach vaccination to aged care facilities. And I'm so proud of them doing that.
At this facility, would you be prepared to lend Queensland's coronial services to assist the federal government's oversight and investigations of drugs such as this midazolam, which apparently is applied using a syringe driver, according to some?
There are protocols and criteria as to what is a reportable death. Irrespective of whether it's a private aged care facility or public, there are reportable deaths. If it is a reportable death, it gets reported to the coroner, and the coroner decides whether there needs to be an inquest in that. So I have no doubt that if it is a reportable death, if there are any serious complaints like that, those matters can be taken up by a coroner in relation to those deaths.
Okay.
Thank you.
Thank you.